The only point of doing medical science is to get it into clinical practice and do something useful for mankind. That's called translational research.
Britain leads the world in biomedical science, and Cambridge leads in the UK. So the translational research we do in Cambridge is of extraordinary importance. To take research and translate it into patient benefit and into commercial success is of immense importance to the nation and to the world. It works best when it's close to patients and close to other scientists and engineers to feed off their ideas and deliver patient benefit as quickly as possible. And to achieve all this, we need space. We need space for laboratories, for treatment rooms, for offices, and we need vision.
At the Addenbrooke site in Cambridge, the biomedical campus will be developed and expanded over the next decade. This vision is founded on the proven capability of Cambridge to bring together the world's best brains, to set up the world's leading biomedical research cluster. This vision and this capability create a new and uniquely prestigious opportunity for funders to build on success. ACT.
Multiple sclerosis is the commonest, potentially disabling disease of the brain and spinal cord affecting young people. So it strikes just when they're starting out on their domestic and professional life as adults.
I was starting to think, well, from going a fit professional golfer to being handicapped and being in a wheelchair, the national average is 15 years. I just got very, very lucky.
The story of Campath-1H, or alemtuzumab, as it's now known, is, I think, a very nice example of how a brilliant scientific discovery can eventually turn itself into a medicine that makes a difference to the life of the individual person with multiple sclerosis.
Now, Alistair, that's how it should be done, and you've helped me with my handicap. My turn to help you with yours.
Ultimately, the purpose of research is to understand the disease well enough so that one can make a big difference to the life of the person with multiple sclerosis so that they no longer face a frightening and uncertain future.
Cambridge University Hospitals includes Addenbrooke's and the Rosie. It is one of the UK's leading hospital trusts and was one of the first NHS Foundation trusts. It has a worldwide reputation for its teaching and biomedical research. ACT is an independent charity whose objects are to support and promote the Trust's aims and activities.
Well, our NHS budget is a large one, but it's all spoken for in terms of the costs of running our 2 hospitals, paying the staff, buying drugs for the patients, and so forth. ACT donations allow us to invest in people, equipment and facilities that our NHS budget couldn't afford. If the donation by ACT can help fund a new build, the Trust doesn't have to pay the mortgage. So what we do in that building becomes that much more affordable. ACT donors provide essential additional funding that makes a crucial difference to patient care.
Having the endowments and ACT is really absolutely critical to getting these expensive new bits of technology in. Together with others, it pulled together and contributed the full amount for the robot. Prostate cancer is the most common cancer in men. There are 35,000 new cases every year in Great Britain and around 9,000 to 10,000 deaths. We're identifying new markers to try and identify those men at risk who need surgery and then those men at low risk who we can manage conservatively. So this will again produce real patient improvement. This research is very exciting. It's cutting edge, it's internationally leading, and it's here in Cambridge.
The University of Cambridge is a highly significant partner. The Trust and the University have come together with Papworth Hospital and Cambridgeshire and Peterborough Mental Health Trust to form Cambridge University Health Partners. The partnership made a successful bid to the Department of Health to become an academic health science centre, one of only 5 created in the UK. All the partners will cooperate closely in the development of the Cambridge Biomedical Campus. Plans include an extension to the Rosie Maternity Hospital, a new children's hospital, a new centre for neurosciences, and a new emergency department.
Our aspiration is to attract major donors who will give enabling gifts for all these developments. We call it our 2020 vision.
ACT is funding a great variety of projects here at Cambridge University hospitals, such as the extraordinary Da Vinci robot, and right here at the Cambridge Breast Cancer Research Unit. Our role in the 2020 vision development is that we are leading a major 100 million capital campaign which will provide for funders both nationally and internationally with exciting new opportunities to support patient care.
So we can start because we have everything set up. The insulin pump here.
My colleague Roman Hovorka is leading a very exciting project designed to improve the treatment of diabetes for children and young adults with type 1 diabetes. This is a very difficult disease to treat. Often involves the patient developing a low blood sugar from overnight frequently. The parents of these children are often very anxious and having to wake the child up in the middle of the night. It would be fantastic if we could have an artificial pancreas to do that job for them. This has been a big challenge internationally, but Dr. Hovorka is a world leader in developing specific systems focused on each individual's physiology to improve the functioning of the artificial pancreas and to bring it into real use in clinical practice.
Once developed, the end product will mean that people can sleep safely because their glucose levels will be monitored and adjusted automatically through the night. Roman is working on the maths behind the software for the controller.
Cambridge is a unique place. It provides validation to our research, to the acceptance of our technology among the professionals, regulatory bodies and patients. It's always better to have a home.
What we've done for many decades is to take our science from the bench to the bedside. And where we are at the moment is taking it from the laboratory to the community. Pound invested here is a pretty sound bet. We have a good track record of success in research and our impact is global. So many of the researchers here on campus have come up with innovations in medical science that have had a global impact.
There are many colours in the healthcare spectrum. Fundraising is achieved through a choir of different voices and orchestrated through many different instruments. For the colours to make a rainbow, for the choir and instruments to create the symphony, all must act together to build on success, to make the most of translational research and improve care for all.